Hi. Hello. Today, I'm going to be reading the Bible that's included with my birth control every single time, despite me never reading it. Nobody ever reading it. It's a Bible. And yeah, so here we go. Important, please read. Consumer information. Evian 21 and Evian 28. Some big words in there, people. Leviosa. Levon orgestrel and ethanol estradiol tablets. This leaflet is part 3 of a 3-part, quote, product monograph, unquote. Why is it the third one when there's only one giant Bible that comes with my pills? Questions. Anyways, 3-part, blah blah blah. Published when Evian 21 and Evian 28 was approved for sale in Canada and is designed specifically for consumers. This leaflet is a summary and will not tell you everything about Evian 21 and Evian 28. Contact your doctor or pharmacist if you have any questions about the drug. I feel like this Bible is supposed to contain all the information I should need if I have a question, therefore I can reference it very quickly, unless I have a more technical question, for example, what the ingredients do. The individual ingredients besides the two bada boops, you know those bada boops. Anyways, moving on. About this medication. What this medication is used for. A, to prevent pregnancy, and B, to treat moderate acne in women 14 years of age or older who are able to use birth control pills, desire birth control, and have achieved menarche. What? Oh, your first menstrual period is referred to as menarche. Menarche? Never learned that in school, but okay. Whatever you say. Paper that comes in this fucking thing every goddamn time I open it. What it does. Evian is a birth control pill, oral contraceptive, that contains 2 female sex hormones. Oh boy, here it goes again. Levonorgestrel and ethanol estradiol. It has been shown to be highly effective in preventing pregnancy when taken as prescribed by your doctor. Pregnancy is always more risky than taking birth control pills, except in smokers older than the age of 35. Birth controls work in 2 ways. 1, they inhibit the monthly release of the egg by the ovaries. 2, they change the mucus produced by the cervix, narrow outer end of the womb. This slows the movement of the sperm through the mucus and through the uterus womb. That is a gross sentence that I wish to never read again. Moving on. Effectiveness of birth control pills. Combination birth control pills are more than 99% effective in presenting pregnancy. Preventing pregnancy when the pill is taken as directed. And the amount of estrogen is 20 micrograms or more. I like how this instruction manual is essentially like formatted in a way where you should know science words. And I'm just a lonely old art student. That's fine. A 99% effectiveness rate means that if 100 women use birth control pills for 1 year, 1 woman in the group would get pregnant. I'd like to imagine this as like 100 women are in a room for 1 whole year, and 1 of them gets pregnant. Like a math question. If 100 women were in 1 room with each other for 1 whole year and no other room, 1 would get pregnant. How? Moving on again. The chance of becoming pregnant increases with incorrect use. Other ways to prevent pregnancy, other methods of birth control are available to you. They are usually less effective than birth control pills when used properly. Oh, there's a period at pills. There's a period at the end of pills, just like how there's usually a period after you take the estrogen, the hormone pills. Then there's 7 days where you don't take pills. Fun facts with ISIS carry. Where was I? When used properly, however, other methods of birth control are effective enough for many women. The following table gives reported pregnancy rates for various forms of birth control, including no birth control. The reported rates represent the number of women out of 100 who would become pregnant in 1 year. Reported pregnancies per 100 women per year. Combination pill, less than 1 to 2. Intrauterine device, that's an IUD. Less than 1 to 6. Condom with spermicidal foam or gel, 1 to 6. Mini pill, 3 to 6. Condom, 2 to 12. Diaphragm with spermicidal foam or gel. I hate how many times I have to say spermicide or spermicidal. 3 to 18. Spermicide, 3 to 21. Sponge with spermicide. God damn it. 3 to 28. Cervical cap with spermicide. 5 to 18. Periodic abstinence. Rhythm. All types. 2 to 20. Okay. No birth control. 60 to 85. Pregnancy rates... Pregnancy rates vary widely because people differ in how Sorry, my brain's dying. I just can't read this Bible every time I take my medication. Pregnancy rates vary widely because people differ in how carefully and regularly they use each method. This does not apply to IUDs since they are implanted in the uterus. Regular users may achieve pregnancy rates in lower ranges. Others may expect pregnancy rates more in the middle ranges. Sorry, my throat is very dry from reading this Bible. Damn, I wish Jesus would turn water into wine for my parched throat over here, but... When it should not be used. The birth control pill is not suitable for every woman. In a small number of women, serious side effects may occur. Your doctor can advise you if you have any conditions that would pose a risk to you. If you see a different doctor, inform him/her or they. Update your fucking pronouns here, Evian. Or Avion, whatever. That you are taking birth control pills. Tell the doctor that your birth control pills are Avion. The use of the birth control pill should always be supervised by your doctor. You should not use Avion if you have or have had any of the following conditions. History of or actual heart attack, chest pain, angina pectoris, or stroke. Blood clots in the legs, thrombophlebitis. I'm going to call that trombone. Legs, pulmonary embolism, eyes or elsewhere. You could have just said blood clots, but moving on. Hereditary or acquired blood clotting disorders. You could have just listed that under blood clots. Blood clots of any sort. Known or suspected cancer of the breast, sex organs, or certain estrogen-dependent cancers. Unexplained vaginal bleeding until diagnosis is reached by your doctor. Partial or complete loss of vision or other vision problems caused by vascular disease, blood vessel disease of the eye. History of or actual liver disease, or history of or actual benign or malignant liver tumor. Jaundice, yellowing of the skin and eyes. or liver disease if still present, heart valve or heart rhythm disorders that may be associated with the formation of blood clots. Just say blood clots. Diabetes affecting your circulation. Migraines, current or history with neurological symptoms such as aura, visual or sensory disturbance. Uncontrolled high blood pressure, hypersensitivity, allergy to any of the components of avian. Levonorgestrel and ethinyl estradiol tablets. See what the important information non-medical ingredients are. You're gonna list that, like where to find this in this Bible? No? Okay. Where was I? Known or suspected pregnancy. Birth control pills should never be taken if you think you are pregnant. They will not prevent the pregnancy from continuing. There is no conclusive evidence, however, that the pill can damage a developing child when taken inadvertently during early pregnancy. Pancreatitis associated with severe hypertriglyceridemia. Okay, current or history. Pancreatitis. What the fuck am I saying? Pancreatitis is the inflammation of the pancreas marked by abdominal pain, whereas severe motherfucker is a very high level of triglycerides in the blood and may show no symptoms. Just pretend I pronounced all of that correctly, please. Thank you. What the medicinal ingredient is. Levonorgestrel and ethinyl estradiol. What the important non-medical ingredients are. Okay. We got to the non-medical ingredients that they mentioned. Each active orange tablet contains the following non-medicinal ingredients. FD&C yellow No. 6 aluminum lake, hydroxypropyl methylcellulose, HPMC, lactose monohydrate, magnesium stearate, microcrystalline cellulose, polyethylene glycol, pre-gelatinized starch, sodium starch glycolate, and titanium dioxide. Each inert light green tablet contains the following non-medicinal ingredients. D&C yellow No. 10 aluminum lake, FD&C yellow No. 6 aluminum lake, FD&C blue No. 1 aluminum lake, lactose monohydrate, magnesium stearate, microcrystalline cellulose, and pre-gelatinized starch. What dosage forms it comes in. Evian, I'm not reading those fucking hormones again. Tablets are available in 21-day regimes, Evian 21, and the 28-day regime, Evian 28. Evian 21, each package contains 21 orange tablets. Each orange tablet contains 0.10 milligrams hormone number 1 and I've given up on saying the names. And 0.02 milligrams ethinyl estradiol. I'll say that one because that one's easier. Evian 28. Each package contains 21 orange tablets and 7 light green tablets. Each orange tablet contains 0.10 milligrams hormone number 1 and 0.02 milligrams ethinyl estradiol, whatever. The light green tablets aren't active, so you're just wasting things. I suppose. In my brain, you're wasting things, so I don't even take those. Warnings and precautions. Serious warnings and precautions. Cigarette smoking increases the risk of serious adverse effects on the heart and blood vessels. This increases with age and becomes significant in birth control users over 35 years of age. Women should not smoke while using birth control pills. Birth control pills do not protect. Birth control pills do not protect against sexually transmitted diseases, STIs, including HIV/AIDS. For protections against STIs, it is advisable to use latex condoms in combination with birth control pills. There are also conditions that your doctor will want to watch closely, or that might cause your doctor to recommend a method of contraception other than birth control pills. Before you use Evian, whatever, talk to your doctor or pharmacist if the following apply to you. Breast conditions. A strong family history of breast cancer. Breast disorders including pain, discharge from the nipples, thickening, or lumps. In some circumstances, benefit may be derived from taking the pill. In other cases, adverse effects may follow. Diabetes, high blood pressure, abnormal levels in fat in the bloodstream, high cholesterol or triglycerides, cigarette smoking, heart or kidney disease, epilepsy/seizures, history of depression, fibroid tumors of the uterus, gallbladder or pancreatic disease, history of liver disease or jaundice, family history of blood clots, heart attacks, or strokes, may be pregnant or breastfeeding, have systemic lupus, erythematosus, have inflammatory bowel disease such as Crohn's disease or ulcerative colitis, have hemolytic uremic syndrome, have sickle cell disease, have problems with the valves in your heart, or have irregular heart rhythm, wear contact lenses. That's a weird one that I wouldn't have expected. If you see a different doctor, inform him or her or they that you're using Evian. Tell your doctor if you are scheduled for any laboratory tests, and certain blood tests may be effective by hormonal contraceptives. I also didn't know that. Also tell your doctor if you are scheduled for a major surgery, recent delivery, or second trimester abortion. You should consult your doctor about stopping the use of Evian 4 weeks before surgery, recent delivery, or second trimester abortion. You should consult your doctor about stopping the use of Evian 4 weeks before major surgery, and not using Evian for a time period after surgery during a prolonged bed rest. Evian should be used only under supervision of a doctor with regular follow-up to identify side effects associated with its use. Your visits may include a blood pressure check, a breast exam, an abdominal exam, and a pelvic exam, including a pap smear. Visit your doctor 3 months or sooner after the initial examination. Afterwards, visit your doctor at least once a year. Use Evian only on the advice of your doctor and carefully follow all directions given to you. You must use the birth control pill exactly as prescribed. Otherwise, you may become pregnant. If you and your doctor decide that for you the benefits of Evian outweigh the risks, you should be aware of the following. Circulatory disorders, including blood clots in the legs, lungs, hearts, eyes, or brain. Ooh. Women who use hormonal contraceptives have a higher incidence of blood clots. Blood clots are the most common serious side effects of birth control pills. The risk of developing clots is especially high during the first year a woman ever uses a hormonal contraceptive. Clots can occur in many areas of the body. This has been recording for nearly 20 minutes now, and I'm just getting to the end of this first flap here. Whew. Be alert for the following symptoms and signs of serious adverse effects. Call your doctor immediately if they occur. Sharp pain in the chest, coughing, blood, or sudden shortness of breath. I feel like you should go to the doctor regardless. Regardless if you're on birth control for that. So that's just some advice for you. These symptoms could indicate a possible blood clot in the lung. Pain and or swelling in the calf. Oh, these symptoms could indicate a possible clot in the leg. Crushing chest pain or heaviness. Oof. These symptoms could indicate a possible heart attack. Sudden, severe, or worsening headache or vomiting. Dizziness or fainting, disturbances of vision and speech, or weakness and numbness. Or numbness in an arm or leg. These symptoms could indicate a possible stroke. Sudden, partial, or complete loss of vision. This symptom could indicate a blood clot in the eye. Any of these conditions can cause death or disability. Clots can occur rarely in blood vessels of the eye, resulting in blindness or impaired vision, or in the blood vessel leading to an arm or a leg, resulting in damage to or loss of a limb. The risk of clotting seems to increase with higher estrogen doses. It is important, therefore, to use as low a dosage of estrogen as possible. I didn't know estrogen causes an increase in blood clot. I was gonna say perhapsin, but that's not a word. Blood clot possibilities, I suppose, is the word I will go for. Sorry, my legs are getting numb because I'm sitting cross-legged. Whew. Oh, that was number 1, circulatory disorders. I don't remember if I said that. Number 2, breast cancer. The most significant risk factors for breast cancer are increasing age and a strong history of breast cancer in the family, mother or sister. Other established risk factors include obesity, never having children, and having your first full-term pregnancy at a late age. It's not looking good for me. So, right? So if you're fat, have never had kids, get your breasts checked. Anyways, some women who use birth control pills may be at an increased risk of developing breast cancer before menopause, which occurs around age 50. These women may be long-term users of birth control pills more than 8 years, or women who start using birth control pills at an early age. In a few women, the use of birth control pills may accelerate the growth of an existing but undiagnosed breast cancer. Early diagnosis, however, can reduce the effect of breast cancer on a woman's life expectancy. The potential risks related to birth control pills seem to be small. However, yearly breast examination by doctors is recommended for all women. This is true. Get your breasts checked. Breast cancer is probably the most common cancer, honestly. However, relatively treatable. And then just regularly monitored. You should probably be fine so long as you have health care. Sorry, America. This is America. Just kidding, I live in Canada. That's why I actually have a prescription. I didn't have to pay full price for it. Anyways. Sorry, I keep running out of breath. Ask your doctor for advice and instructions on regular self-examination of your breasts. 3. Cervical cancer. Some studies have found that an increase of cancer of the cervix in women who use hormonal contraceptives, although this finding may be related to factors other than the use of oral contraceptives. However, there is insignificant evidence to rule out the possibility that oral contraceptives may cause such cancers. Chronic infection with the human papillomavirus, HPV, is believed to be the most important risk factor for cervical cancer. In women who use COCs for a long time, the chance of getting cervical cancer may be slightly higher. This finding may not be caused by the pill itself, but may be related to the sexual behavior or other factors. 4. Liver tumors. The short and long-term use of birth control pills have also been linked to the growth of liver tumors or liver injury. Example, hepatitis, hepatic function abnormal. Such injury or tumors are extremely rare. Contact your doctor immediately if you experience nausea, vomiting, severe pain, or a lump in the abdomen. Gallbladder disease. Users of birth control pills have a greater risk of developing gallbladder disease requiring surgery within the first year of use. The risk may double after 4 or 5 years of use. Use in pregnancy. Oh, that's number 6. Sorry. Birth control pills should not be taken by pregnant women. They will not prevent your pregnancy from continuing. There is no evidence, however, that the birth control pill can damage a developing child. You should check with your doctor about risks to your unborn child from any medication taken during pregnancy. 7. Use after pregnancy, miscarriage, or an abortion. Your doctor will advise you of the appropriate time to start the use of Evian after childbirth, miscarriage, or therapeutic abortion. Running out of steam here. 8. Pregnancy after stopping Evian. You will have a menstrual period when you stop using Evian. You should delay pregnancy until after another menstrual period occurs, within 4 to 6 weeks. In this way, the pregnancy can be more accurately dated. Contact your doctor for recommendations on alternate methods of contraception during this time. 9. Use while breastfeeding. If you are breastfeeding, consult your doctor before starting the birth control pill. The hormones in the birth control pill are known to appear in breast milk. Adverse effects on the child have been reported, including yellowing of the skin, jaundice, and breast enlargement. You should use another method of contraceptive. The use of oral contraceptives is generally not recommended until the nursing mother has completely weaned her child. Interactions with this medication. Certain drugs may interact with birth control pills to make them less effective in preventing pregnancy or cause an increase in breakthrough bleeding. Oh, is that like spotting? I wish they used language that the common man could understand, but yeah. You may also need to use a non-hormonal method of contraception during any cycle in which you take drugs that can make oral contraceptives less effective. Drugs that may interact with Evian include drugs used for epilepsy, such as barbiturates, example, phenobarbital, and phenytoin, primidone, topiramate, carbamazepine. Certain drugs used in the treatment of tuberculosis. Should have got vaccinated. Example, the rifampicin, rifabutin. Drugs used for HIV or AIDS, such as ritonavir. Goddamn. Herbal products containing St. John's wort. I don't want his wart anywhere near me. Hypercum. Probably hypercum. Hypre. Whatever. Porphyratum. Antibiotics, example penicillins, tetracyclines for infectious diseases, cyclosporin, antifungals, cholesterol lowering drugs, example, oh boy, clofebrate, antihypertensive drugs for high blood pressure, anti-diabetic drugs for insulin, for diabetes, prednisone. Fun fact, my vet before he died said that my cat should go on prednisone because she had megacolon. But this isn't about her, she's dead now. Not because she didn't take the prednisone. This was like years after. She died just like Elvis. Anyways, sedatives and hypnotics. Example, benzodiazepines, barbiturates, chlorohydrate, glutamate, metrobate, antidepressants. Example, clomipramine. Other drugs such as phenylbutazone, analgesics, modafinil. It sounds like a kid reading from a fucking script. Continuing. Trolindomycin, vitamin E, and vitamin B12. Oh, I get vitamin B12 injections every month. Please inform your doctor and pharmacist if you are taking or have recently taken any other drugs or herbal products, even those without a prescription. Also tell any other doctor or dentist who prescribes another drug, or the dispensing pharmacist, they use Avion. They can tell you if you need to use an additional method of contraception, and if so, for how long. This is not a complete list of possible drug interactions with Avion. Talk to your doctor for more. Why don't you list all the drugs that can interact negatively with the drug that I am taking and reading a fucking summary for? Obviously, your doctor should also go over the list of meds that would, I was going to say complicate, it's not the word, conflict with birth control. But just in case they don't, you should be able to read something that comes with the meds. My metformin doesn't come with a whole fucking Bible of shit. But I feel like it's kind of important. My ADD meds don't come with that, and that's technically an amphetamine. Pokey pokey. Proper use of this medication. Usual dose. How to take Avion. 1. Read these directions before you start taking the pills, and anytime you're not sure what to do. 2. Look at your pill pack to see if it has 21 or 28 pills. 21 pill pack, 21 active pills with hormones taken daily for 3 weeks, then no pills are taken for a week. It has a lovely diagram. Or 28 pill pack, 21 active pills with hormones taken daily for 3 weeks, then 7 reminder pills with no hormones taken daily for 1 week. I was gonna say something other than I decided not to. 3. You may wish to use a second method of birth control, example latex condoms or spermicidal foam or gel. Stop saying spermicidal, please, for the love of God. For the first 7 days of your first cycle of pill use, this will provide a backup in case pills are forgotten while you are getting used to taking them. 4. When receiving any medical treatment, be sure to tell your doctor that you are using birth control pills. Many women have spotting or light bleeding, or may feel sick to their stomach during the first 3 months on the pill. If you do feel sick, do not stop taking Avion. The problem will usually go away. If it does not go away, check with your doctor or clinic. 6. Missing pills also can cause some spotting or light bleeding, even if you make up the missed pills. You also could feel a little sick to your stomach on the days you take 2 pills to make up for the missed pills. 7. If you miss pills at any time, you could get pregnant. The greatest risks of pregnancy are when you start a pack late, or when you miss pills at the beginning or very end of the pack. 8. Always be sure you have ready another kind of birth control, such as latex condom or spermicidal foam or gel. To use as a backup in case you miss pills, and an extra pack of pills. 9. If you experience vomiting or diarrhea, or if you take certain medications such as antibiotics, your pills may not work as well. Use a backup method such as latex condoms and spermicidal foam or gel until you can check with your doctor or clinic. 10. If you forget more than one pill 2 months in a row, talk to your doctor or clinic about how to make pill taking easier or about using another method of birth control. If your questions are not answered here, call your doctor or clinic. Why aren't you answering my questions here if they're simple questions that should be answered in the Bible you fucking sent with my medication? When to start the first pack of pills, be sure to read these instructions before you start taking the pills, and anytime you are not sure what to do. Decide with your doctor or clinic what is the best day to start taking your first pack of pills. Your pills may be either a 21-day or 28-day cycle type. You already went over this, but continuing. 21-day combination. With this type of birth control pill, you are on pills for 21 days and off pills for 7 days. You must not be off the pills for more than 7 days in a row. Your first day of menstrual period, bleeding, is day 1 of your cycle. Your doctor may advise you to start taking the pills on day 1, on day 5, or on the first Sunday after your period begins. If your period begins on Sunday, start that same day. If Evian tablets administration is initiated after day 1 of the first menstrual cycle or postpartum, contraceptive reliance should not be placed on Evian until after the first 7 active tablets have taken for consecutive days. Non-hormonal methods of contraception such as latex condoms and spermicidal foam or gel should be used for the first 7 days of tablet taking. 2. Take 1 pill at approximately the same time every day for 21 days. Then take no pills for 7 days. Do you want to specify which pills you shouldn't be taking for those 7 days? That's a very broad statement. Start a new pack on the 8th day. You will probably have a period during those 7 days off the pill. This bleeding may be lighter and shorter than your usual period. 2 ways to remember in what order to take the pills. Follow the days of the week, as shown above the pills. 2. Always finish the orange tablets before going on to the week when you are off the pills. 28-day combination. With this type of birth control pill, you take 21 pills that contain hormones in 7 days that contain no hormones. The first day of your menstrual period, bleeding, is day 1 of your cycle. The doctor may advise you to start taking the pills on day 1, on day 5, or on the first Sunday after your period begins. If your period begins on Sunday, start that same day. If Evian tablet administration is initiated after day 1 of the first menstrual cycle or postpartum, contraceptive reliance should not be placed on Evian until after the first 7 active tablets have been taken for 7 consecutive days. Non-hormonal methods of contraception such as latex condoms, spermicidal foam, or gel should be used for the first 7 days of tablet taking. 2. Take 1 pill at approximately the same time every day for 28 days. Begin a new pack the next day, not missing any days. Your period should occur during the last 7 days of using that pack. 2 ways to remember to take the pills. Follow the days of the week as shown above on the pills. Always finish the orange tablets before going to the light green inactive pills. We are now nearly at 39 minutes. We just finished in this middle section here. Fill this here. Oh damn, I couldn't even fold it over because it's not folded on the fucking line correctly. What to do during the month. 1. Take a pill at approximately the same time every day until the pack is empty. Try to associate taking your pill with some regular activities such as eating a meal or going to bed. Do not skip pills even if you have bleeding between monthly periods or feel sick to your stomach, nausea. Do not skip pills even if you do not have sex very often. 5. When you finish your pack, 21 pills, wait 7 days to start the next pack. You will have a period during that week. It's very presumptive. My uterus is an independent woman. 28 pills. Start the next pack on the next day. Take 1 pill every day. Do not wait any days between packs. Overdose. Overdosage may cause nausea, vomiting, breast tenderness, dizziness, abdominal pain, and fatigue/drowsiness. Withdrawal bleeding may occur in females. In case of overdosage, contact your doctor or pharmacist or call your local poison control center immediately. Problem is, those symptoms are so common just in everyday life. I feel like there should be another symptom perhaps listed there, or maybe like a dosage listing, just like a general dosage that would list. What do I know? Misdose. What to do if you miss pills. Birth control pills may not be as effective as if you miss pills. The following chart outlines the actions you should take if you miss one or more of your birth control pills. Match the number of pills missed with the appropriate starting time for your type of pill pack. I'll read the Sunday start, and then I'll read other than Sunday start. Sunday start. Miss one pill. Take it as soon as you remember, and then take the next pill at the usual time. This means that you might take 2 pills in one day. Miss 2 pills in a row. First 2 weeks. 1. Take 2 pills the day you remember, and 2 pills the next day. 2. Then take 1 pill a day until you finish the pack. 3. Use a non-hormonal backup method of birth control if you have sex in the 7 days after you miss the pill. 3rd week, keep taking 1 pill a day until Sunday. On Sunday, safely discard the rest of the pack and start a new pack that day. Use non-hormonal backup method of birth control if you have sex in the 7 days after you miss the pill. You may not have a period this month. If you miss 2 periods in a row, call your doctor or clinic. Miss 3 or more pills in a row. Anytime in that cycle, keep taking 1 pill a day until Sunday. On Sunday, safely discard the rest of the pack and start a new pack that day. Use a non-hormonal backup method of birth control if you have sex in the 7 days after you miss the pills. You may not have a period this month. If you miss 2 periods in a row, call your doctor or clinic. That's the other side. Other than Sunday start. Miss 1 pill. Take it as soon as you remember, and take the next pill at the usual time. This may mean that you take 2 pills in one day. Miss 2 pills in a row. First 2 weeks, take 2 pills the day you remember and 2 pills the next day. Take 1 pill a day until you finish the pack. Use a non-hormonal backup method of birth control if you have sex in the 7 days after you miss the pills. 3rd week, safely dispose of the rest of the pill pack and start a new pack a day. This seems a lot like the other, like the Sunday start, but whatever. You may not have a period this month. If you miss 2 periods in a row, call your doctor or clinic. Miss 3 or more periods in a row. Oh, it's not period. Although you should go to a doctor for that. Miss 3 or more pills in a row anytime in the cycle. Safely dispose of the... Oh! This one's different. Safely dispose of the rest of the pill pack and start a new pack that same day. Use a non-hormonal backup method of birth control if you have sex in the 7 days after you miss the pills. You may not have a period this month. If you miss 2 periods in a row, call your doctor or clinic. Almost at the end. No, 28-day pack. If you forget any of the 7 reminder pills without hormones in week 4, just safely dispose of the pills you missed. Then keep taking 1 pill each day until the pack is empty. You do not need to use the backup method. Be sure you always have on hand a non-hormonal backup method of birth control, such as latex condom or spermicidal foam or gel, in case you miss pills, and an extra full pack of pills. If you forget more than 1 pill 2 months in a row, talk to your doctor or clinic about ways to make pill taking easier or using another method of birth control. Non-contraceptive benefits of birth control pills. Several health advantages have been linked to the use of birth control pills. Combination estrogen and progestin birth controls reduce the incidence of cancer of the uterus and ovaries. I feel like that directly contradicts the other 2 pages, but go off, queen. Birth control pills reduce the likelihood of developing benign, non-cancerous breast disease and ovarian cysts. I mean, I'm not a doctor, but I can relatively confirm that, of that I have PCOS. Users of birth control pills lose less menstrual blood and have more regular cycles. The risk of developing iron deficiency anemia is thus reduced. I have very low iron. And I've been on birth control for years. But, you know, I'm sure it would be worse. Perhaps. I don't know, I'm not a doctor. Who am I, a doctor? There may be a decrease in painful menstruation and premenstrual symptoms, PMS. I've never understood PMS, but maybe that's because I've never read the Bible before. Acne, excessive hair growth, and male hormone-related disorders also may be improved. Side effects and what to do about them. Some users of birth control pills have unpleasant side effects. Oh, is my phone dying? It just went very dim. Oh shit, 5%! Okay, it's a bit higher, because I had to plug in my phone, and I'm just gonna hope that it balances well on this charging cord. Where were we? Oh, here we go. Side effects and what to do about them. Some users of birth control pills have unpleasant side effects. Most side effects are temporary and are not hazardous to the health. There may be tenderness of the bone. See, that's what I was talking about. Okay, we have another solution. Let's hope it lasts more than 15 seconds. There may be tenderness of the breast, nausea, and vomiting. Some users will experience weight gain or loss. Many of these side effects occurred with high-dose combination birth control pills. These side effects are less common with the low-dose pills prescribed today. Unexpected vaginal bleeding or spotting and the changes in the usual menstrual period may also occur. These side effects usually disappear after the first few cycles. They are not an indication to stop taking birth control pills unless more significant complications occur. A decision to stop using the pill or change the brand of pill should only be used after 3 consecutive months of use. Occasionally, users develop high blood pressure that may require stopping the use of birth control pills. Other side effects may include growth of pre-existing fibroid tumors of the uterus, an increase or decrease of hair growth, sex drive, and appetite, skin pigmentation, headaches, abnormal liver tests, nausea, vomiting, severe pain or lump in the abdomen, rash, and or vaginal infections. Infrequently, there is a need to change the contact lens prescription or an inability to use contact lenses. I did not know that. That's pretty cool. A woman's menstrual period may also be delayed after stopping birth control pills. There is no evidence that the use of the pill leads to a decrease in fertility. As mentioned, it is wise to delay starting a pregnancy for 1 menstrual period after stopping birth control pills. Serious side effects, how often they happen, and what to do about them. It's a chart. I will try reading it as cohesively as possible. Symptom / effect. This is like the top of the chart that lists shit. Talk to your doctor or pharmacist, only if severe, in all cases. Stop taking drugs and call your doctor or pharmacist. Okay. So these are all apparently uncommon, which I find interesting. Why aren't you listening to common ones? Whatever. Sharp pain in the chest, coughing, blood, or sudden shortness of breath. Stop taking drug and call your doctor or pharmacist. Pain or swelling in the leg. Stop taking drug and call your doctor or pharmacist. Crushing chest pain or heaviness. That goes with the first fucking thing. Why are you listing shit individually if you're not just gonna list it after commas after commas after commas? What the fuck? Stop taking drug and call doctor or pharmacist. Sudden, severe, or worsening headache, or vomiting, dizziness, or fainting, disturbance of vision, of speech, or weakness, or numbness in an arm or leg. Oh, there is a check. Stop taking drug and call your doctor or pharmacist. Abnormal liver test and or nausea, or vomiting, severe pain, or lump in the abdomen. See, this one is listed under talk with your doctor or pharmacist in all cases. That's interesting because most of those symptoms are listed in one of the previous ones that said stop taking drug and call your doctor or pharmacist. whatever. Persistent sad mood. Stop taking drug and call your doctor or pharmacist. Yellowing of the skin or eyes. Jaundice. Stop taking drug and call your doctor or pharmacist. Unusual swelling of the extremities. Talk to your doctor or pharmacist in all cases. Breast lumps. Talk to your doctor or pharmacist in all cases. Unexpected abnormal vaginal bleeding. Talk to your doctor or pharmacist in all cases. This is not a complete list of side effects. For any unexpected effects while taking Evian, contact your doctor or pharmacist. How the fuck am I supposed to know if this is unexpected effects if they're not listed in this goddamn Bible you gave me? Use your brain, whoever writes this bullshit. How to store it? Store at a room temperature of 15 to 30 degrees Celsius. So this is how you know it's a Canadian copy, because Americans don't know what the fuck that is. My apartment is currently at 25 degrees Celsius, so that's cool. Evian 21 and Evian 28 should be protected from light once opened using protective covering provided. Oh, that's the little condom cover for it. That's not a problem because my apartment doesn't have any windows, so that's cool. Keep out of reach of children and pets. I don't have any of those because my cat is dead. She was both my baby and my pet. Reporting suspected side effects. You can report any suspected adverse reactions associated with the use of health products to the Canada Vigilance Program by one of the following three ways. Report online at www.healthcanada.gc.ca/medeffect. Call toll free at 1-866-234-2345. Complete a Canada Vigilance reporting form and fax toll free to 1-866-678-6789 or mail to Canada Vigilance Program, Health Canada, Postal Locator 0701E, Ottawa, Ontario, K1A0K9. Postage paid labels, Canada Vigilance Reporting Form, and Adverse Reaction Reporting Guidelines are available on MedEffect, trademark, Canada website at www.healthcanada.gc.ca/medeffect. Note: should you require information related to the management of side effects, contact your health professional. The Canada Vigilance Program does not provide medical advice. For more information, I added some words there. More information. This document, plus the full product monograph prepared for health professionals, can be found by contacting Teva Canada Limited at 1-800-268-4127, extension 005 for English, or 1-877-777-9117 for French, or druginfo@tevacanada.com. Why isn't it .ca? Have you not been watching the Goose commercials for your domains? This leaflet was prepared by Teva Canada Limited, Toronto, Canada. M1B2K9, last revised June 29th, 2015. Oh, y'all gotta update your shit. You gotta make better pronouns. Anyways, that's this entire Bible, including my ums, buts, and interjected comments. This has taken 53 minutes and 45 seconds. At the time of me reading that, obviously it's longer now. Now, if you excuse me, I'm going to include this in a collage for my collage methodologies courses. Shout out to Vlad. Hope you enjoyed that fucking rant. I'm not happy. It is 3:36 a.m. and I have a 11 o'clock course tomorrow. Bye!